For months, it's been getting harder for people across Europe to find basic medicines. The European Medicines Agency says there is a shortage of 13 drugs, including those needed to leukemia, diabetes, and the symptoms of COVID-19. Some say the EU needs to consider building up a stock of 3 to 4 months' supply of the most needed medications so that shortages can be avoided.
In the laboratory of the Delpech pharmacy in Paris, medicines are being prepared. In this case, it's the common antibiotic, amoxicillin. The owner here says since people stopped wearing masks, they are catching more infections again, so the demand for simple medication is higher, and the major pharmaceutical companies cannot keep up. The shortage of medicine applies across Europe. At this Berlin pharmacy, staff are increasingly having to find alternative drugs to those doctors have prescribed in order to help their patients.
Basically, we have a lot more work to do to supply the population with medicines. So far, we've still somehow found a solution for people, but we often have to improvise. So sometimes we release another active ingredient more strongly than was prescribed and then have to adjust the dosage.
Even simple treatments to treat coughs and colds are harder to come by.
I would have preferred a cough syrup, but the pharmacist offered it to me in tablet form. That's okay. The most important thing is it helps. The same active ingredient is in it, so I'm satisfied.
The problem is not just affecting simple painkillers and antibiotics across the continent. The European Medicines Agency says currently 13 key drugs are in short supply. 2 are for fighting arthritis and help combat the symptoms of COVID. Another 2 are to help patients who've had a heart attack or a stroke. Among the remainder are drugs to fight leukemia, diabetes, and to prevent the rejection of transplants.